All right, Ty, thank you. Well, it is becoming a growing concern for young athletes as back injuries are becoming more prevalent. Orthopedic surgeon Dr. Richard Lehman with the U.S. Center for Sports Medicine is with us this morning with ways to prevent back injuries and also some treatment options if you do have one. Good morning to you.
How are you?
I'm great. So how big of an issue back injuries, right?
Well, you know, it's interesting. We used to always worry about Tommy John, elbow injuries, and growth plate injuries. And now we're seeing this inordinate number of back injuries, 15 to 20%, which is a significant number for athletes. 100 kids, 20 kids are going to have back pain.
What specific sports are you talking about? Or is it not even all sports?
It's a good question.
Yeah.
So a lot of it's weightlifting, a lot of it's overuse, pitching, a lot of it is running and training. And then some of these kids are playing 2-3 sports, so they're getting overloaded just season after season.
Yeah, so I mean, what are some ways to prevent a back injury?
Well, I think the first thing you have to do is you have to take a season off. So you're 12, 13 years old, you have to take one season off. Number two, everybody should be on a flexibility program. It takes you 10, 15 minutes. You do it 2-3 times a week. And then some strengthening exercises at home. But the biggest thing is for the parents to be vigilant. Talk to your kids. You know, ask them, is your back been sore? Have you been sore? Is your elbow sore? Etc. And I think that communication really helps us get to these things early.
Yeah, at what point do you know with your child that it's time to maybe see an orthopedic surgeon?
I think the answer is 2 weeks. So if your child has some back pain, not uncommon, give them a little Tylenol, you rest them, maybe miss practice. But I think if they go 2 weeks, 14 days, 17 days, and their back pain doesn't really change, then you may want to call a pediatrician, call us, call your orthopedic surgeon, and be seen.
Yeah, what are some treatment options?
Well, the biggest thing is going to be one, rest, light bracing, and generally physical therapy. And I would say physical therapy is probably the hallmark of getting rid of back pain and then stopping it from recurring.
Yeah, and you're dealing with all kinds of athletes right now. And that's the thing. I think before you think football, but now it's across the board.
Absolutely,
Yeah.
and I think that's a concern. Sure, if you hit somebody with your helmet, you may injure your back, you may injure your neck, but just imagine you take someone who's a swimmer or someone who's a non-contact athlete, a golfer, but the repetition gets to you, and yeah, we're seeing it every sport.
Yeah, and when they come in, are they basically mostly going into physical therapy, or is it serious?
Well, we MRI them.
Yeah.
When generally we start them on physical therapy.
Okay.
Some of them are going to need surgery. They have a herniated disc. That's a small percentage. And most of them get better with PT, physical therapy, and a few small percentage will end up with an injection or something a little more invasive.
Yeah, I did feel like I heard groans at home when you said you need to take, a season off, right? I mean, from coaches, from parents, even the kids are like, oh, I can't do that. I have to remain competitive.
Yeah, I think we all heard that.
Yeah.
And in the office, that's the first thing. Dad's like, what do you mean
Yeah,
you
you
have to take
can't
a
do
season
that,
off?
right.
But I think that if you're looking at longevity, your son or daughter may be playing D1 sport or continuing in their high school career or maybe going on beyond that. You have to rest somewhere.
Absolutely. Orthopedic surgeon Dr. Rick Lehman, thank you so much.
My
we
pleasure.
Appreciate it. We're going to take a break. We'll be back.